Dr. Tessah S. I'm a board-certified dermatologist practicing here in San Fernando La Union in the Philippines. So my video for today is about eczema. And actually, eczema is a very broad topic, and I just like to go through some points about it, how you can manage it, what are the things you should watch out for, and my tips for you. So I hope you like this video. So the first thing is, what is eczema? Eczema is a general term for dermatitis that results to red, itchy, and inflamed skin, which at times may blister, ooze, or peel. It is a common condition, yet largely manageable. Although eczema is interchangeably used with atopic dermatitis, there are differences between these two. In fact, there are several types of eczema, namely atopic dermatitis, considered severe and long-term, so that's skin asthma. Number 2, contact dermatitis. Contact dermatitis could be allergic or irritant type of contact dermatitis. Allergic is a delayed type of reaction. Irritant is more immediate type of reaction to the irritant. Dyshidrotic eczema. This one usually presents with blisters on the hands or feet. Next is nummular eczema. It presents as coin-shaped lesions in the legs. And then what else? Seborrheic dermatitis. Usually this is like yung dandruff, and if it's napabayaan or becomes more severe, it could have like some lesions in the chest and also in the back of the ears, and in my eyebrows, sides of the nose. Next is Tessah dermatitis. This one is the lesions are in the legs, usually associated with varicosities or mga leg veins. So, is eczema contagious? No, it's not contagious, okay? Hindi siya nakakahawa. Next is, who is at risk for eczema? Eczema usually affects children. It mostly happens during the first 2 years of life. Should it develop between ages 2 and 5, the eczema tends to be more persistent. So, for example, you have a child, usually, first 2 years of life, medyo sensitive talaga yung skin yan. And then, kapag nag-progress yan, more than 2 years old, na meron pa rin siyang mga skin problems, sometimes they carry on until adulthood, na meron talaga silang skin condition. So, in adults, eczema occurs in only up to 4% of individuals. While it is rare for the first episode of eczema to occur in adulthood, it could turn out to be chronic if it does. So, meaning, kapag matanda na, pag adult na, only 4% of the population could have the eczema. However, if you are part of that 4%, mas chronic na siya. Talagang parang na siya, matagal na pabalik-balik na condition. So, what causes eczema? The exact cause of eczema is still undetermined. So, hindi pa rin namin alam. However, the following risk factors or combination may lead to flare-ups. So, number 1, genetics, environmental triggers like pollution and other allergens, poor hygiene, and sometimes vaccine. So, the visible part of the skin called the corneal layer continuously renews itself and protects the skin from germs, and with eczema, this layer is unable to provide ample protection due to a damaged skin caused by inflammation or lack of immune response, or lack of moisture, So there. So what happens is, kasi may problem with the corneal layer. The corneal layer is pinaka-top layer ng skin. What I just said is that sometimes, diba, when you have an eczema, this layer, hindi siya normal. May problem dun sa pinaka-top layer ng skin. Kaya, dahil may problem doon, it can cause inflammation. When you say inflammation, namamaga siya agad. That's why it becomes red. And then, sometimes also, there's a lack of moisture, so very dry siya. Like, for example, in patients with atopic dermatitis, kulang sa moisture. That's why they are prone to have an eczema because there's no moisture protecting their skin sa taas. Some patients, actually, I want to point this out, they think when you apply a moisturizer, hindi siya gamot. But for patients with atopic dermatitis, actually, that is the management already. Yun na talaga yung gamot. Because the skin is very dry. So, we have to pack the top layer of the skin to protect it so that you protect it not only from the infection, you protect it from the dryness, you protect it so that when it's not dry anymore, you will protect it na it won't become itchy. So, please seek a consultation with a board-certified dermatologist because there are a lot of parang details about it that we can tell you personally when we see you. We can explain it to you better, and yun. Some patients, it's individual kasi. They can have like a mild eczema. Others, they can have a really moderate to severe one na. So, iba na talaga yung pag-educate namin sa kanila. So there. Next, what are the symptoms of eczema? The symptoms of eczema may differ from person to person, although the common telling signs are itching, so makati talaga siya, which could worsen when the skin is inflamed or scratched. So, when the patient scratches it, syempre mas mangangati. Okay, so we always recommend to at least please iwasan na kamutin. Dry, sensitive skin. So when the skin is dry, it's automatic itchy. Red, inflamed skin. When it's red, there's inflammation. There are a lot of causes why it's becoming inflamed. Sometimes it's already a cycle. That's why it's becoming inflamed. Dark colored patches of the skin. This one is kapag mas matagal na naging maitim na. Rough, leathery, or scaly patches of the skin. This one, when it comes leathery, ibig sabihin makapal na from chronic scratching of the skin. Blisters that easily break and leak and eventually crack, crust, and thicken. So, because of the constant scratching, the skin is prone to infection. That's why there are blisters occurring. There's parang naging basa na siya, nagka-crust pa siya, and there's like oozing pus. Swollen areas. Ito kapag talagang mas naging infected na yung area, it can swell already. So, these are the things that you will notice in a patient with eczema. So, in babies, eczema commonly appears on the cheeks, the arms, and the legs. Usually sa exposed areas yan talaga kasi, for example, babies, they like to crawl, diba? So, dun sila lalabas. For toddlers, if they're always wearing shorts, yun, sa exposed areas naman yan makikita. And the face din, because it's the one that's already exposed, it's the one that dries out very fast. Bihira na makakita ng ganyan sa, yun nga, in yung mga singit-singit, mga in mga inguinal area, sa may areas that are already moist. It's usually in the exposed area because it gets dry easily. Next is in children, teenagers, and adults, symptoms often show up on the back of the knees, inside the elbows, and the back of the neck. Note, however, that eczema can appear any part of the body. So, maraming peculiarities yan. For this type, for example, atopic dermatitis, dito yan. Pag seborrheic dermatitis, dito naman yan. But sometimes, they look alike. Diba? Parang if you Google it, it may be this one, it may be the other one. So, like I said again, just have a consultation with a dermatologist. The dermatologist nearest you will be able to, or your chosen dermatologist will be able to help you, educate you, and see firsthand ano ba talaga yung sakit sa balat. Sometimes if it's parang very challenging, we might have to do a skin biopsy to confirm. Next, what happens if I scratch the affected area? It is natural to scratch itchy skin, but it is essential to avoid getting caught in the itch-scratch cycle, which could worsen eczema and result to complications. Superficial wounds due to scratching could leave the skin vulnerable to infection, which may have to be treated with antibiotics to prevent the spread of infection. So you have to consult the doctor. So for my patients who really have like ganyan na namamaga na, swollen na, I prescribe an oral antibiotic para mabawasan agad yung bacteria ng skin, because it's not just eczema causing the problems, there's already a superimposed bacterial infection. So how is eczema diagnosed? Itchy rashes that resemble eczema develop on any part of the body, especially the type that recurs. You have to consult a dermatologist. He or she will perform a physical exam. Ibig sabihin, we will examine the patient to first rule out other possible skin conditions and determine if it is indeed eczema. So what is the treatment? So the treatment for eczema will depend on the severity and age. The dermatologist will recommend ideal regimen. So it could be an over-the-counter treatment like a moisturizer, a gentle skin cleanser, special soaps, or shampoos. Prescription topical. So example of this is topical corticosteroids, steroid creams. I do see a lot of patients who self-medicate now with topical corticosteroids. So please be careful, because even if this is a medication na ina-apply lang, topical medications also have side effects. Okay, so be careful. I've met patients who is in long-term nag-apply ng steroids who did not have a consultation. Maraming side effects talaga, and we can personally explain to you the side effects, prevent it from occurring so that hindi ka mapapagastos, kasi minsan sa dami ng in-apply, mas napapagastos pa. Topical calcium urine inhibitors, phosphodiesterase inhibitors, skin barrier creams to help protect the skin's physical barrier from irritation and dryness. Next is phototherapy, yung pinapailawan siya. This is not yung pupunta kayo sa beach para magpa-araw because there are patients I talk about phototherapy, it's the same as magpapaaraw under the beach. Hindi, because this one in phototherapy is a controlled wavelength of light. Either it's UVA, UVB, there's a timing, it's a medical grade light for the treatment of your skin condition. It's not the same as going under the sun, because with that, going under the sun sa beach is both UVA, UVB, hindi siya controlled, hindi siya directed dun sa skin problem. So there is a difference. So systemic medications, such as oral drugs for moderate to severe cases, including antihistamines. Sometimes biologicals are also recommended. So what are the non-steroidal topicals? Okay, so non-steroidal topicals are known as topical calcineurin inhibitors, which are applied to areas of the skin affected by the eczema. So stop parts of the immune system for overreacting, thus preventing eczema symptoms like itching and redness. Unlike corticosteroids, topical calcineurin inhibitors can be used for extended periods of time. So you have to consult your board-certified dermatologist to recommend which one will be best for which part of the body that is affected. And lastly, how else can you control the eczema? Eczema can have an impact not only on a person's health, but also on quality of life. So on top of treatment, strive to control symptoms and manage eczema by knowing the triggers, regularly bathing and applying the appropriate skin moisturizer. When you say regularly bathing, wag naman like 3 to 4 times a day. At least 2 times a day is enough. Not too long, mga 10 minutes, because sometimes the patients, they take like 30 minutes just to take a bath. Mas mag-strip off yung skin mo ng barrier, mas mag-dry yung skin if you take too long baths. Use lukewarm water, not hot water, not cold water. Don't put a lot of products in the water. Some naglalagay ng kung ano-anong mga dahon-dahon, hindi siya okay. It will just dry out your skin. Seek consultation with a board-certified dermatologist. And then next is watch out for signs of infection. Signs of infection is oozing, may pus, it's swollen, and that's the time that you really have to have a consultation with the doctor. So there, thank you so much for watching this video. I do hope you like this video. Subscribe to my channel and comment below, because I'm the one personally answering your questions and your comments. And I hope to see you in my next video. Bye!